All right, today we're diving into a topic that gets to the very heart of how our bodies work, or sometimes how they work against themselves. We're talking about multiple sclerosis, or as you probably know it, MS. Think about that for a second. What would happen if the very system designed to protect you, your immune system, suddenly got its wires crossed and saw you as the threat? It's kind of like your own personal security detail turning on you. And that's exactly what we're going to unpack.
So, what is MS really? Well, at its most basic level, it's a chronic disease where your immune system makes a huge mistake. It starts attacking your central nervous system, the absolute command center for your entire body, the brain, the spinal cord, and even the optic nerves in your eyes.
And here's a great way to picture what's going on. Imagine all the nerves in your body are like electrical wiring. They need that rubber insulation to work properly, right? Well, in our bodies, that insulation is a fatty substance called myelin. In MS, the immune system basically starts stripping away that insulation. And you can guess what happens next. The electrical signals from your brain get scrambled, they slow way down, or sometimes they just don't get through at all. Okay, so here's a quick look at where we're headed. We'll cover what MS is, the many different ways it can show up, how doctors diagnose it, what the treatments look like today, and finally, how people are truly living full and active lives with the condition. All right, let's dive right into our first section. What exactly is multiple sclerosis? We've called this the body's civil war, and that's really not an exaggeration. It's truly a conflict happening inside the body. And the name of the disease itself tells you a lot. The word sclerosis actually comes from a Greek word that means scarring. So multiple sclerosis literally means multiple scars. These scars, which doctors call lesions, are the actual physical evidence of the damage left behind after the immune system attacks that myelin insulation. Now, this brings us to a really crucial point, which is our next section, the many faces of MS. And if there's one word to remember here, it's unpredictable, because how MS affects one person can be completely different from how it affects another. So, as you can see, the most common form by a long shot is called relapsing-remitting MS, or RRMS. About 85% of people start out with this type. And all that means is they have periods where symptoms flare up, those are the relapses, followed by periods where things calm down or go into remission. For the other 15% or so, the disease tends to progress more steadily from the get-go. So, what does one of those relapses actually feel like? Well, some of the common early signs can be things like blurry vision, or even pain in one eye. Numbness, or that pins and needles feeling, is another big one. And then there's this overwhelming fatigue. And we're not just talking about being tired, it's a whole other level. You might also see weakness in an arm or leg, or have issues with balance. It really all depends on where that damage is happening. But then you have all the symptoms that nobody else can see. Things like brain fog, where it just feels impossible to think straight, or big shifts in mood and depression. A really common one is sensitivity to heat. Getting just a little too warm can make all the symptoms feel way worse for a bit. And honestly, for a lot of people, these invisible symptoms can be the absolute toughest part to deal with. And that really drives home the main point here. You can almost think of MS as a fingerprint disease. It is totally unique to each person. No two experiences are the same, because it all comes down to exactly where those lesions, those scars, are located in the brain and spinal cord. So if it's so different for everyone, how in the world do you diagnose it? That's our next section. And yeah, it's not like there's one simple blood test. It's much more like a piece of clinical detective work. Okay, so doctors have a few key tools in their belt. They'll start with a neurological exam, testing things like your reflexes, your balance, your vision. But the real game changer is the MRI scan. That's what lets them literally see those areas of damage in the brain and spinal cord. And then they'll often run other tests, like blood work or maybe a spinal tap, mainly to make sure they rule out anything else that might look like MS. All right, so once all that detective work leads to a diagnosis, the next question is obvious. What do we do about it? And that brings us to treating MS. And I have to say, the news here is genuinely good. The modern toolkit we have to fight back against this disease is bigger and better than it has ever been. When it comes to treatment, there are really three main goals. Goal number 1, reduce how often relapses happen and make them less severe when they do. Goal 2, slow down the overall progression of the disease over the long haul. And goal 3, which is just as important, is managing the symptoms day to day to help people have the best quality of life possible. The main weapons in this fight are a class of drugs called disease-modifying therapies, or DMTs for short. Basically, these are designed to calm down that out-of-control immune system. And the great thing is, There are a lot of different options now. Some are injections you can give yourself, some are pills you take every day, and others are infusions you get at a clinic. Having all these choices makes it so much easier for doctors and patients to find the right fit. And that's the perfect lead-in to our last and, I think, most important section, living a full life. Because managing MS goes way beyond just taking medication. It's about creating a whole lifestyle, a path forward that's healthy and sustainable. And this is where a lot of the power comes back to the individual. Things that might seem simple can make a huge difference. Staying active, for example, is fantastic for both fatigue and mood. Being smart about not getting overheated is key. And we know for a fact that smoking makes MS worse, so not smoking is a big one. And of course, taking care of your emotional well-being, connecting with people, that's absolutely vital. And speaking of management, this is so important. We're talking about consistency with your medication. These DMTs, they're not a quick fix, they're a long-term strategy. You can see on the do side, take it consistently, report any side effects, keep your appointments. And on the don't side, never ever stop your meds without talking to your doctor. Don't skip doses. It really is a partnership, and sticking with the plan is one of the most powerful things you can do. And really, this quote says it all. Is there a cure for MS yet? No. But is it manageable? Absolutely. The big takeaway here is that people with MS can and do lead full, active, amazing lives. The outlook today is truly one of empowerment and hope. So I want to leave you with this thought. Whether this is about your own health journey or about supporting someone in your life, understanding is the first step. So what's just one small step you can take today, maybe even right after this, to better understand your own health or to be there for someone else? Just one small thing. Thanks so much for joining me.